Welcome back. Today is World Autism Awareness Day, which makes a perfect time to educate ourselves and understand a little bit more about autism. And joining us now to provide that information is Dr. Chris Holcomb with Tandem Therapy Services. Good morning, Chris. Thank you so much for joining us.
Good morning, Cassandra. Nice to meet you. Thanks for having me.
Of course. And now, Dr. Chris, can you tell us what is Autism Spectrum Disorder or ASD?
Sure. Autism spectrum disorder is a developmental disorder characterized by repetitive patterns of behavior, difficulties with learning language, and difficulty with social interaction. Spectrum simply refers to a wide range of symptoms and skill levels seen with individuals with autism. Although a person can be diagnosed at any age, most signs are seen early in childhood and can affect daily functioning and learning. Some of the signs that are seen are difficulty responding to one's name, poor eye integration, having difficulty with joint attention, having trouble with shared enjoyment, and imitating visually. ASD is in every racial and ethnic group across all socioeconomic levels. Boys are significantly more affected by ASD at a ratio of 4-to-1. According to a recent sample of 11 states, the Center of Disease Control and Prevention now estimate 1 out of 54 children as having ASD.
And that's a lot of children. When you say 1 in 54, do we know why the numbers have increased so substantially over time?
Right now, we really aren't sure. We know there's a genetic link, but there's some environmental links that we're unsure of as well.
Okay. And what should parents do if their child has been diagnosed with autism?
So if a family is finding out that their child has been diagnosed with autism, they should find treatment providers immediately to work with their child as soon as possible. While there is no cure for autism, there are behavioral interventions designed to identify and remedy specific symptoms by teaching socially significant replacement behaviors and communication, and improve eye integration and language. Board-certified behavior analysts will create treatment plans or teaching plans utilizing empirical science and evidence-based interventions to improve socially significant behavior to help children learn across the lifespan.
And tell us, Doctor, a little bit about Tandem Therapy Services and what you offer to parents here in the Las Vegas community.
Tandem Therapy Services was established in the summer of 2000 to bring a collaborative and comprehensive treatment approach encompassing applied behavior analysis, speech therapy, and occupational therapy to the Valley. Tandem has been instrumental in teaching individuals with ASD for over 25 years, as well as training new practitioners to treat children due to the increased number of children being identified here in the Valley. Senate Bill 96, sponsored by Senator James Orenthal, has recently introduced and is attempting to bring up Medicaid rates up to the national average here in the state of Nevada. This will allow the state of Nevada to help try to find more treatment providers to help treat all the children that we're finding across the world. Currently, Nevada ranks second to last in reimbursement rates, which does not allow the state of Nevada to compete with other states.
Yeah, and Dr. Chris, we have all of your information up on the screen. I know we could talk to you for hours on this subject, as I know autism, it affects so many lives. Thank you so much for joining us this morning. We really appreciate you. And of course, if you want more information, you can visit their website right there on the screen. Stay with us more. We'll be right back.